If you are over 50 years old and every single morning you wake up and take a blood pressure pill, this video is something you genuinely need to watch. I am not here to scare you. I am not here to tell you to stop your medication. I am here to share something honest, something that most doctors simply do not have enough time to sit down and explain to you properly. And this information directly affects your energy, your health, and the quality of every single day you live. So please, give me the next 15 minutes. Just 15 minutes for yourself. Because what you are about to hear could change the direction of your health completely. High blood pressure, medically known as hypertension, hypertension, has become one of the most common health conditions in the world. Hundreds of millions of people are living with it right now, and the vast majority of those people are between the ages of 50 and 70. Your doctor writes a prescription, you fill it, you take the pill every morning, your blood pressure reading looks a little better, and you tell yourself, okay, it is working, everything is fine. But is it really working the way you think it is? Today, we are going to talk about the two most commonly prescribed classes of blood pressure medication for people in this age group: ACE inhibitors, ACE inhibitors, and beta blockers. I want to walk you through how they actually work inside your body, where they start to go wrong, and what conversations you can have with your own doctor to make sure you are on the best possible path for your age and your specific condition. Picture your typical morning. You take your pill. An hour later, your blood pressure reads normal. But somehow, you still feel exhausted. You still feel dizzy when you stand up too quickly. You are not sleeping well. Your mind feels a little foggy. Your chest feels heavy some days for no clear reason. So you tell yourself, well, I'm getting older. Maybe it's the weather. Maybe I'm just stressed. Maybe I need more rest. But here's what most people never realize. Those exact symptoms are very often caused by the very medication they are taking to feel better. These blood pressure drugs do lower your numbers. That part is true. But in doing so, they slow down your circulation to a degree that your brain, your muscles, and your vital organs receive less oxygen than they actually need. And this becomes especially dangerous after the age of 50, because your body is already naturally slowing down on its own. When you add a medication on top of that, the combined effect can work directly against your well-being. A study published in the American Journal of Medicine found that nearly 40% of older patients who had been on long-term blood pressure medication were experiencing significant side effects that were quietly reducing their quality of life, and in most cases, their doctors were completely unaware of it. Let me explain the science behind this in the simplest way possible. ACE inhibitors, medications like lisinopril and enalapril, work by blocking a chemical in your body that causes blood vessels to tighten. When that chemical is blocked, the vessels relax, and blood pressure comes down. The concept is sound. But here's the problem. These drugs also cause potassium to build up in the body. Too much potassium leads to irregular heartbeats, muscle weakness, and added strain on the kidneys. After the age of 50, your kidneys are already functioning at 15 to 20% less capacity than they were in your younger years, so adding a medication that puts extra pressure on them can quietly accelerate kidney decline, often without any obvious warning signs until the damage is already done. Beta blockers, medications like atenolol and metoprolol, work differently. They slow the heart rate down, blood pressure drops. But when the heart slows down, the brain receives less oxygen, and over time, reduced oxygen to the brain shows up as memory problems, difficulty concentrating, persistent low mood, unexplained anxiety, and in many cases, sexual dysfunction. What makes this particularly dangerous is that these symptoms develop so slowly and so gradually that people almost never connect them to their medication. They just assume it's aging. They accept it, they live with it. There is another serious concern with beta blockers that is rarely discussed. These medications interfere with the body's ability to regulate blood sugar. For anyone who is already at the edge of developing diabetes, which is an enormous portion of people in the 50 to 70 age group, this is a genuinely significant risk that deserves a real conversation with your doctor. I want to share some warning signs with you now. Go through this carefully. If 3 or more of these apply to you, please make an appointment with your doctor this week and bring this directly up. You wake up in the morning feeling more tired than when you went to bed. You feel dizzy or lightheaded when you stand up from a chair or get out of bed. Your hands or feet feel cold much of the time. You are waking up multiple times during the night to use the bathroom. You have had a persistent dry cough for months that simply will not go away. This is one of the most well-documented side effects of ACE inhibitors and is almost always overlooked. You feel sad or anxious without any clear reason. Physical activity that used to feel manageable now feels significantly harder than before. Your memory feels less sharp, or you find it difficult to focus the way you once did. These are not simply signs of getting older. These are recognized, documented side effects of blood pressure medication, and they appear more frequently and more severely in people over 50. You deserve to know that. Now, I want to be very clear about something. I am not saying your doctor made a mistake. I am not saying the medical system has failed you. Doctors are working under enormous time pressure. A typical appointment is 5 to 10 minutes. They check your reading, they write the prescription, they schedule the next visit. The deeper conversation about how you are actually feeling day to day, your energy, your sleep, your mood, your mental sharpness, that conversation often simply doesn't happen, not because your doctor doesn't care, but because the system doesn't give them the time. So that conversation has to come from you. Here's what most people are never told. Blood pressure is not just a number that a pill controls. Lifestyle changes, real, consistent lifestyle changes, have been shown in clinical research to be as powerful as medication in many cases. The DASH diet, which is built around fruits, vegetables, whole grains, and significantly reduced sodium, has been shown in studies to lower systolic blood pressure by up to 11 points on its own, no medication involved. There is also something deeply important that your doctor may have not revisited in years: the fact that not every blood pressure medication works the same way for every person. Your genetics, your kidney function, your age, your existing conditions, all of these factors determine which medication is genuinely right for you. And in many cases, especially for people over 50, calcium channel blockers like amlodipine have been shown to produce the same blood pressure control as beta blockers with significantly less side effects. But unless you ask, that conversation may never happen, and the dose you were prescribed 5 or 10 years ago may not be the right dose for your body today. Your body has changed. Your medication may need to change with it. So, let me tell you what you can actually do starting today. The first thing is the most important. Go to your doctor and ask one direct, simple question. Say, "Doctor, given my age and my current health condition, is the medication I'm on truly the best option available to me? And is there anything else we should be considering?" That question is your right to ask. Any good doctor will welcome it. Start keeping a simple daily health journal. Nothing complicated. Just write down each morning how you felt when you woke up, whether you experienced any dizziness, what your energy level was like throughout the day. This information is genuinely valuable to your doctor and gives them something real to work with instead of just a blood pressure reading. Take sodium seriously. Most of us consume far more salt than we realize, and reducing it, even moderately, can produce a measurable drop in blood pressure without any medication at all. Walk for 30 minutes every day. Not running, not intense exercise, just walking. It's the single most consistently proven, safest, and most accessible intervention for blood pressure management at any age. Morning walks in particular reduce stress hormones and naturally train your heart to function more efficiently. And finally, get a digital blood pressure monitor for your home. Measure at the same time each morning and each evening. Write the numbers down. Bring that record to your doctor. It gives a far more accurate picture of your true blood pressure than a single reading in a clinical setting, and it helps your doctor make far better decisions on your behalf. I want to leave you with this. You are not just a patient. You are a person who has lived 50, 60, or 70 years of life. You have experience, you have wisdom, and you have every right to be an active, informed participant in decisions about your own health, not just someone who accepts a prescription and asks no questions. If 3 or more of those warning signs apply to you, please do not wait. Make that appointment this week. Have that conversation. One honest conversation with your doctor could change the entire direction of your health. And if this video helped you today, share it with someone you love who is over 50 and taking blood pressure medication. You may be doing them one